Welcome back. I am Dr. Ali Sabbour, Professor of Vascular Surgery, Ain Shams Medical School, Cairo, Egypt. This is part 2 of clinical evaluation of the peripheral arterial tree. This introduction will help you to be actively engaged in your next clinical ward session. In part 2 of this presentation, we will explain the different clinical presentations of a patient with chronic lower limb ischemia due to gradual occlusion of his arterial tree. Normally, muscles need more blood supply during exercise to compensate for the increased metabolic rate. With gradual arterial stenosis, the blood flow may be enough at rest, so the patient will not complain. However, with exercise, accumulation of metabolites within the muscles will result in muscle pain and cramps that will force the patient to stop walking. As the patient rests, the metabolites are gradually washed out and pain disappears. If the patient exercises again, the muscle pain will return. The lower limb cramping muscle pain that comes with walking and relieved by rest is a characteristic symptom of chronic ischemia. This pain is called claudication. You will learn how to analyze the symptom of claudication in your clinical ward session. Now, if the blood supply decreases more, the circulation will not be able to respond to the metabolic needs of the lower limb even at rest, and the patient will complain of pain at rest. This is called ischemic pain. In your clinical ward session, you will learn how to analyze rest pain and to differentiate ischemic rest pain from other causes of foot pain that can result without ischemia. Color change of the feet and toes is a common complaint. Sometimes the patient may complain of rubor discoloration of his limb with dependency. This is how it looks like. Look to the left side. Try to guess the reason of this rubor color with dependency. This will be explained in more details in your clinical examination session. If the blood supply further decreases and is not enough to maintain tissue viability, tissue loss in the form of an ulcer or gangrene will result. Please note that gangrene may develop as well if the metabolic needs increases due to infection or trauma without an equivalent increase in the tissue perfusion, and that is due to the pre-existing chronic ischemia. I'm going to explain this further in your ward session. So to summarize, the main complaints or the main symptoms of chronic ischemia are: number 1, claudication; number 2, ischemic rest pain; number 3, different grades of color changes; and number 4, tissue loss in the form of ischemic ulcers or gangrene. In the following parts of this presentation, we will start clinical examination. Clinical examination includes inspection, palpation, and auscultation. Part 3 will demonstrate the physical signs that can be seen in a patient with chronic ischemia, that is, inspection. Thank you.